Hello, everybody, and welcome to another season of Science Talks. Thank you for joining us this evening. Glad that you could join us again. I hope you had a good Christmas Eve. For those of you who are new to Science Talks is a virtual science cafe and is a series of online informal talks where anyone can come to explore the latest ideas in science, research, and technology. These talks are followed by a Q&A session, and they're designed to engage the public in learning about recent research in science. And all of the talks are given by experts in the field and provide an opportunity to stimulate discussion around some of the most exciting topics in modern science. And before we get started exploring the latest ideas in research and science, we'll go through a few ground rules, and then I'll pass you over to my co-host, Tiffany. So we'll just ask that all of you keep your microphone muted, and if you would like to ask questions at any point during the talk, please send a chat, and during the Q&A sessions, we'll draw upon those chats to engage with our speaker. And just so you guys are aware, the event is being recorded, and you can get a copy of it by email afterwards. This is meant to be a conversation and not a debate, so you can take your boxing gloves off. We're welcoming a wide range of questions, so don't be afraid to be too edgy. We want to bring those, but we just want to make sure that even though we encourage wild and wacky questions, that this is a safe environment and we're not here to fight, and we want to include all sorts of perspectives in the conversations that take place. So we'll introduce the speaker shortly, but what you can expect is we'll have a talk from an expert. We'll go into a Q&A session, and then we'll do a quick conclusion, and we'll do a group photo and screenshot of all your smiling faces so we can share it afterwards. So before I continue on, I'd like to introduce you to my co-host, Tiffany. Tiffany, take it away.
Hello, everybody. Thanks so much, Josh. And I just wanted to give a quick shout out to some amazing companies that have helped us get started. And this project received its initial assistance from the City of Abbotsford through the Abbotsford Community Foundation Grant and Responsible Neighborhood Small Grant Fund. Thank you so much. As well, I wanted to say thank you to some of our other amazing sponsors, the University of the Fraser Valley, the Abbotsford Tech District, as well as Connext, the UFV Alumni Association, and TEDx Abbotsford. We couldn't be here without all you amazing supporters. Thank you so much. And today I am very excited to be bringing to you Dr. Martha Dow. We will be learning about turning knowledge into action with UFV's CHASI Hub, Reinventing Community Research. Tonight, she will be talking about the Community Health and Social Innovation Hub as a new way of engaging with communities. In these times, an important undercurrent of our work is the development of innovative strategies to address the different impacts of the pandemic. The Hub has and continues to develop formal and informal partnerships with communities, governments, as well as industries. Dr. Martha Dow is an associate professor of sociology at UFV. She has completed her BA and MA in sociology at the University of Western Ontario and her PhD in educational studies at UBC. Dr. Dow's interests lay in strengthening the relationships between public policy decisions and the lived experience of the individuals and communities impacted by these decisions. Thank you so much for joining us, Martha. You can pop up.
I'm trying.
Always how it works.
Now I feel kind of funny, but I don't have a video piece coming up here as an option. Something strange happening.
Let's
everybody.
see if we can get but welcome anyway. Lovely to hear your voice.
I don't have a start video at the moment.
Let's see here. I think our tech guy will pop it up. There we go.
Okay.
Welcome.
Yeah, great. Well, actually, anybody that knows me that's out there will be thinking this is just classic Martha and technology. So that was actually perfect.
You're not alone.
There we go. Well,
I'll let you take it.
Yeah, thanks very much for the introduction. And certainly I was very pleased to be part of this series of speakers. I know that we want to leave a lot of time for comments and discussion and questions, so I'll try to get right to it. And I am in the hub, as you can, some of you will know and notice, so that's great for me. I'm going to focus on this relatively new Community Health and Social Innovation Hub that we finally refer to as CHASI. We believe it's a new take on how UFV engages with its communities on research. Before we opened our doors, our president, Dr. McLean, who has been incredibly supportive of this initiative, called CHASI a potential game changer for UFV. And I think we can now delete the qualifier of potential. Having said that, certainly the focus of my talk is CHASI, and I do want to mention for context and any questions later that I am a sociologist by trade and fortunate to have been at UFV 26 plus years now, teaching and doing community research. Also, in case anyone has any questions later, I'll also mention that I've been very fortunate to teach courses about things we don't tend to want to talk about, sexuality, death, deviance. From a methods point of view, I am trained in both quantitative and qualitative methods and spend a lot of time these days doing policy analysis and program evaluation work. As mentioned, my work in my communities has allowed me to work heavily in public safety, education, and health. And I hope that I've always brought a critical lens with respect to diversity and inclusion in my work. So let's talk about CHASI. We opened our doors this past April. Yes, that was at the beginning of a pandemic. So not great timing in so many ways. And yet the perfect time in many others, as our commitment to serve our communities is even more important at this time than we imagined when we conceived of the hub. Importantly, the idea for the hub was brought to us from the community, and that's a critical point for us. The university didn't decide that it needed another research center. Our communities, specifically the divisions of family practice, and those divisions work with general practitioners, in Abbotsford, Chilliwack, and Mission, brought forward the idea of this incubator research type space. As they expressed, first, that they felt they needed a more nimble and timely support from the community to support their evidence-based decision makings in terms of service delivery. And secondly, they really felt a strong desire to have a stronger working relationship with the university. So given our time, I won't go into the whole process about how we got to opening the doors, but it is critical to know that First Nations Health Authority and Fraser Health Authority were joined the three divisions. And so those 5 partners were our founding partners and were with us right from the beginning. It's also important to note that the divisions in Abbotsford, Chilliwack, and Mission pooled their innovation dollars for an entire year to give us $300,000 seed money to get this initiative started. And then the university did a fantastic job renovating the space and support. So, and the space is important. I really wish, I guess not all of you could be in here right at the moment, but I really wish you can see and look forward to when you can see the space. Certainly those initial dollars have been incredibly important, as probably one of the biggest impacts we've noticed in COVID in relation to the hub is sort of that sustainability around funding in these times. So we're deeply appreciative of the division's support. So I want to talk about 2 things, are the lens that we use and then that model. And again, for those who know my lack of tech, I just want you to know that these actually, had some transitions going on earlier. So when we look at this slide, it looks ridiculously simplistic, obviously. And yet these elements can be incredibly elusive in the university context. All of our work focuses on access, equity, and knowledge mobilization as the lens through which we see what we do. And unfortunately, we don't have to look very far to understand that the other side of that coin is inequality, barriers to wellness, and an anti-intellectualism that perpetuates the challenges faced by our social institutions. And it obstructs out-of-the-box, creative, innovative approaches to improving health and wellness for individuals and communities. And that's important because that's really what the hub was conceived to do, start to think outside the box in terms of what we can do to improve individual and community health and wellness. So I'd like to talk just really briefly about each of those aspects of our lens, and then a little bit about the model, and then just open it up. Certainly, and I'll use some examples just really briefly as I'm talking about it, about projects, initiatives that we have going on that are at some stage of development or in the hopper, as my mother used to say. So equity. So whether talking about our work on older adults and social isolation, or vulnerable youth, or the disproportionate risk of residential fire for Indigenous communities, an equity lens informs what we do, who we do it with, and how we collaborate with our communities. In all three of those examples, the populations of interest, older adults, youth, Indigenous communities, are central to the construction of the problem statement, the research method design, and the mobilization of knowledge gathered in ways that support respectful, sustainable, and meaningful change. When we think about access, whether we're talking about our work related to sexualized violence, or working with a local nonprofit organization to raise community awareness about the need for medical equipment in their hospital, or assisting a community in understanding food security for those most in need, all of those projects and many others place accessibility as a prerequisite for wellness. And knowledge mobilization. One of our secret weapons, and although for those of you who know or will come to know our team, we have a lot of secret weapons, was the hiring of a visual project specialist. The position is central to our mission as we work with our partners to mobilize knowledge accrued in ways that can positively impact our communities. Whether it's making traditional research reports more accessible, or developing interactive opportunities to work with data that we have access to, or commissioning a student to produce a mural, like the one behind me, or working with community partners on artwork to be exhibited on our sizable canvas if you were to come into the space that's on the left of the entrance. These and many more examples are important to us because our community told us that they were important to them. So knowledge mobilization, so often in my career, I've been asked to do work and handed checks to do it where I've said, you don't need me. We have the knowledge already. We just have to figure out how to mobilize it in such a way that it's useful to the people that need the knowledge. There's a tremendous work that's done in our university and many universities, and I don't think we've always done a very good job at making sure that communities have access to that information in ways that they can use it. So that's the lens that we use. I wanted to briefly comment on sort of the model or our approach, if you will, and the lens informs that. So the three key elements as we think about them are student development, interdisciplinary approaches to what we do, and being community responsive. So on student development, every project or initiative that the hub undertakes has student involvement and meaningful student involvement. Right now, just to give you a sense, we have 5 current undergraduate students working as paid research assistants, 2 paid interns as part of our knowledge mobilization team, and a business technology practicum starting in a couple of weeks. For us to have 8 undergraduate students recruited and working as part of the hub team in the middle of a pandemic, when there are almost no students on campus, is incredibly gratifying for us in the middle of these difficult times. And I cannot tell you how often, certainly students are uplifting me in these times. And I think it's been incredible for students to really feel part of some solutions and some brainstorming and some creative projects during this time. So we're thrilled about that. Our RAs, our research assistants, are working on a variety of issues, including projects on food security, sexualized violence, as I mentioned, and circumstances contributing to post-secondary students leaving earlier than when they've achieved their credential. And that is becoming an increasing area of interest these days with respect to the added pressures that come with COVID. I spoke about our interns. We have 2 interns, and we're thrilled to have an incredible student working. One of those is working on social media as a key pillar of our knowledge mobilization strategies. And our second intern is an exceptional graphic design student who, by her description, brings her Indigenous lens to create original design work to promote CHASI's projects and issues associated with access and equity in relation to wellness. As well, I want to mention that 3 of our RAs are part of our Research Assistant Development Program, or what we refer to as RAD. And this is where individual or internal and external partners can bring forward funds to support a student and that student then becomes sort of that organization's a resource, right? So if there's issues that the organization is interested in, then we will mentor the student in looking at some of those issues. And it's a great opportunity for students to kind of also chart their own course. If they wanted to work a little more on their quantitative or qualitative methods skills, then that's something we can work into their partnership with the community funder. And finally, I wanted to mention that we recently received confirmation that we were successful in securing 3 MyTax Accelerate interns. And I mention that because it's a great opportunity where MyTax is an organization that supports, up until COVID, it was just graduate student interns, but they've expanded their program and they match funds. So they find an industry partner. In this case, the divisions acted as the industry partner. And then MyTax provided matching dollars to have 3 more interns supported. So then interdisciplinarity, I wanted to mention as well. CHASI truly is interdisciplinary, not just in terms of the teams we put together to do the projects, right, once they're established, but really right from the outset, right from the point that the idea sort of comes together. We bring as many frames of reference to the issue and kind of workshop it, if you will. For example, in the pandemic, long-term care residents and their families, as we all know, have been disproportionately and tragically impacted by both COVID and indeed the isolation that has resulted from the public health orders. So as this was brought forward to CHASI by a community stakeholder, we pulled together a table with sociologists, psychologists, physicians, engineer, and developed a proposal that spoke to the construction of community in these residences and in individual experiences of isolation and connectedness. And that was against a backdrop of technological interventions that were brought to the table, including social robots to respond to this critical issue. What was interesting further, as this interdisciplinary team sort of sat and played with these ideas and thought about what next, the parallels to the experiences of youth became really obvious. And so an offshoot of that discussion became another proposal looking at youth isolation and also looking at the same forms of technology to support youth during this difficult time. Tables and whiteboards are our bread and butter. And I have to tell you, since the team left the physical space at the hub in November with those public health orders, we constantly talk about missing the board. And those of you who have visited will know about that. I just look over and right now we've got about 48 projects, some of which aren't up, just kind of there. And it's been wonderful for people to be able to latch on to projects and express an interest in working on something that they may not have worked on before. Final thing I want to mention in terms of interdisciplinarity is that we're very excited that we have 16 faculty associates. And for those in the audience outside the university setting, this is an appointment of our faculty who have expressed an interest in being formally associated. It's a 2-year renewable term. So we have 16 representing 9 different disciplines across 3 faculties. And we've got 3 more just about to go through that actually are 3 more additional disciplines as well. And we really believe that our approach is a key motivator for the excitement that we're seeing both internal and outside of the university. So finally, most importantly, is our commitment to being community responsive. All of this, our lens to which we understand our mission, our approach is all driven by what brought this idea to the university, which is the community. We are driven by an imperative to be community responsive. And I've been doing this work for a very long time out in the community, but what drew me to this initiative was that our university was engaging in this work in a different way. So it means not just responding, it means being collaborative, it means being timely in order to assist with whatever our partners bring to the door. And like many institutions, universities can move a wee bit more slowly than we'd like sometimes. Having said that, I need to acknowledge that our research office has been incredibly supportive as we all work to sort of strengthen that nimble and timely piece of the puzzle, which I think is really this really critical piece of the puzzle. So whether we are responding to a city council trying to better understand the needs of older adults to most effectively serve them in and beyond the pandemic, or working with a national organization trying to determine the most efficient locations for fire centers serving Indigenous communities, or collaborating with a local youth organization asking for assessment to determine the service needs of preteens experiencing significant mental health challenges. All of these issues, needs, requests require meaningful partnerships driven, we think, by a commitment to respond in ways that support equitable, accessible, and sustainable supports to individual and community wellness. So while the pandemic has made so many things difficult for so many people, we feel incredibly privileged, and we feel a great sense of responsibility to contribute to the work of supporting, restoring, and building healthy communities. So I'm going to stop there, and I really appreciate you listening. We are incredibly excited about what's going on here at the university, and I'd be very pleased to enter into a conversation.
Thank you, Martha. Thank you for giving us the rundown on CHASI. And before I jump into some deep questions, I'd like to extend to the audience the opportunity to ask any questions in the chat, and we'll touch on those in a moment. But Martha, I've got a question for you. Before we started today, you talked about the artwork behind you. Can you tell the audience what the artwork represents and who did it?
Yeah, I can. Well, I can easily brag about who did it because it was my daughter, one of my incredibly talented daughters, who, the important part of that story, by the way, is that she's a University of the Fraser Valley visual arts student. So Avery Dow-Kenny is the artist. And it says, you may not be able to tell, but it says "Together Empowered." And I have to tell you that a few of us have been able to come into the hub over the last week or so, quite frankly, for really supporting our individuals that are working here that might be living alone or needing some sort of connections. So, and when you see the mural, it's in a huge boost. So it really sets a tone. The other thing that's really important around in terms of this is it's another good example of the engagement with students. So here was a student that had a chance to pitch 4 concepts and get feedback and then complete the art in the space. Thanks for asking, Josh.
Hey, no worries, and it looks great. It really livens up the space. So CHASI is for starting to think outside the box on individual and community health and wellness. What has been a top takeaway or insight from CHASI that maybe you didn't expect to find?
Yeah, I think how quickly people became excited about the idea and the nature of the community of the research that we're doing. We just didn't have another space that all of a sudden you could have a whole lot of people working around a problem and really being able to workshop it unless you planned it, right? So we might have meetings where we would do that as faculty, but the idea of students getting to hear an idea quite literally come in the door and start to workshop that right away we have what we refer to as hub huddles every morning at 9:30 to chart our day and to connect. And you can see them all on the screen, students and the other staff, because I should have mentioned, I mentioned our current students. We also have 5 more staff, 4 of which are graduates of UFV, and I can't believe I didn't mention that. And a few are, one's in a PhD program, one's in a master's, one's completed a master's, and everything in between. Incredible team. And I can see them in the mornings in our hub huddles. They've already got the ideas generating, they've already started Googling, et cetera, and they're exchanging readings, and so that's been wonderful.
Perfect. Well, I've got a question from the audience here. You mentioned that you're working on a range of projects related to health and wellness. Can you share an example of how your work is changing the way our healthcare system is thinking and delivering care?
Well, I can't say that what we're doing is changing the system yet. And so I think a couple of things I'd say to that. When we're talking about, and maybe I can bridge this with the question I see Rebecca put in the chat about the social robotics as an example. So if we're starting to think as an example about the impact of the pandemic and even how we organize our physical plant around long-term care, well, if we can start to think about how there's companionship, and it's not the only kind of companionship, but companionship through a form of technology, that starts to change how you develop work patterns, shifts, traffic patterns. We've got a project looking actually at traffic patterns in long-term care facilities. That starts to have system change in terms of how we think about how we organize our work, how we organize our care for when something like this happens. So that's what I'd say. We're trying to work at getting people to think about things from a different way than they might have thought about them before.
Okay, and this is kind of connected to another question. What methodology do you use for that?
Well, for that particular one, it would be multi-method. So as an example, in terms of, and this is a nice way to connect what students are doing too as well, we've got, we're doing quantitative work where we've had surveys that have been implemented, and then the students are engaging using software such as SPSS to analyze the data. We had the good fortune that we have a incredibly forward-thinking vice president of students who sponsored some students to do some data analysis on data that had been collected over the last few years of our own student body. So there's quantitative sides. We also have projects that use interviews. We've got a project that we're collaborating with Cindy Jardine, who's research chair here at UFV, who's the lead investigator on this. So there's focus groups and interviews. So we do qualitative work around that, and then use software such as NVivo to do that analysis.
Okay. So yeah, it's quite intensive, it sounds like.
And by intensive, you meant fun, right, Josh?
Oh man, it wouldn't be fun if it wasn't slightly intensive, right? Well, you talk about intensive and fun. The work behind you is fun. Yeah, it's also intensive. And you touched on the role and importance of the visual artist on your team. Can you maybe expand on where the important impacts of having that visual artist and what that enables you to do?
Yeah, so we've got a couple. So I mentioned we've got a student intern who's a visual artist, graphic design student who's doing a lot of that. And what we're already hearing with her work is that it's in a social media setting where it's so text heavy so often that having that original art that sort of magnifies a particular issue is incredibly powerful. And then we also have this visual project specialist that we've hired, and that has had a huge impact in terms of our community partners starting to think about what kind of product they want from CHASI. So in some cases that's switched. Instead of having a formal report, they're asking for, could we have a dashboard? Could we have something that's interactive? We're doing a mapping project working with one of our GIS professors on that. And so the client all of a sudden is thinking about, well, maybe I don't want a report in its traditional way. Maybe I want something that our board can interact with. We can change and manipulate ourselves. So that I think is really important as we move forward. And it goes to the heart of being useful, right? We've got lots of reports that sit on shelves. That's not what we want to be about.
Being useful is pretty important.
You'd think.
Yeah. So you mentioned a few times the importance of community engagement. In what ways can community actors be involved with your hub?
Yeah, thanks. So lots of different ways. We are structuring an external advisory group. So that's one form in terms of more strategic planning. It's a little tough because the vision of the hub had a lot to do with this space. And as I sit in here alone in it, on a campus that is empty, I'm really struck by, we have to be innovative in our innovation, in our innovation hub, if you will. So the vision was to have lots of traffic and events and engagement and getting people in the community to really feel comfortable coming in and exchanging ideas, much like you're doing right now on a screen. But wouldn't it be lovely if we were all sitting around and moving around and having that conversation? So we'll hopefully get to a place where we're back to that again. So as of now, people can certainly come as part of our organizations with ideas. It doesn't mean always that you come with resources. We've had many organizations come and say, I need this. I just don't know. I don't know how to fund it. I don't know how to ask the right questions. We don't know how to sort of get to the end goal, and we can help facilitate that, very definitely. And as we move through this, we're also trying to transition some of our events to an online format so we can continue to have that exchange of ideas with, kind of the general public as well.
Perfect. So I've got a question from Joanne here. Do you aspire to engage collaborators from other disciplines?
Yeah, so we're never maxed out, and I would always say that to our president. Yeah, we don't, it's a great point. Like, we've got 16 of these internal already, and it just keeps growing. And the model is that you can't max out because, for instance, I just had a call from a faculty associate today that said, hey, I got this little bit of money. Can I bring it through CHASI? But I need this support. And absolutely. And then we can add faculty associates because they're bringing the work through, or we're going to them and saying, we had a climate action proposal that one of our great biology professors was really interested in submitting, but for a bunch of factors needed support in putting the proposal in. So all of a sudden, our students who don't have a science background are trying to figure out, talking about microplastics, trying to connect with the various professors around it. So yeah, the more disciplines that we can draw on, the better, absolutely. And again, we've got 3 more that I think, we add 3 more disciplines once we put those through as well. So just to give you a quick example, because I didn't mention, so we've got kinesiologists, we've got nursing faculty, we've got business faculty, we've got CIS, we've got GIS, computer information systems and spatial and mapping, sociology, anthropology. We're getting a really great array for sure.
Perfect. I've got a question here from Daniel. Does bioethics play a role, and do you collaborate with such services?
My answer would be, I bet bioethics plays a role. And I bet there's all sorts of projects where that would be a central piece of that. And not so sure about a service around that. And if it's one point maybe I could make around that for many that wouldn't know, one of the important things about CHASI and the work we do is that we obviously then can avail ourselves when we're doing projects that involve human subjects. We always run through our research ethics board that is governed by, tri-council policy, et cetera, which is another great thing for students to understand in terms of the ethics of doing research when you're involving human beings. So, but also Daniel's question reminds me that I am not, I'm not an expert about anything, but I'm a sociologist by discipline. So the power, I would argue, of what we're trying to do is say, well, I don't know, Daniel, can you tell me more about what you're thinking about there? And then all of a sudden we bring players into the room who can have a meaningful conversation and bring me along to understanding it as well.
I think you don't give yourself quite enough credit. You're definitely an expert compared to me. So I've got another question here from John. What challenges do you see to sustain and grow the CHASI model?
Yeah, I mean, it's a difficult thing to say in this time because so many people are suffering around the globe. But it's money. It's resources. That's the trick. This is a time where sustainability is what we're after, so that it's students in the community know this is going to be here. So we're trying to be creative. Where we might have corporate sponsors, it's a little trickier time for obvious reasons. So that's, I think, our biggest challenge is sustainability. I'm very optimistic. I tend to be glass half full. We've taken that $300,000 with the divisions, and we haven't spent it all. We're stretching every penny. But yeah, that's the biggest challenge, is, if you will, keeping the lights on, even though I know our president would make sure the lights are on.
Okay, I got a question here that is, you mentioned the collaboration with MyTax, which connects research and the economy. Is the hope of CHASI to have projects that will have a life of their own outside of CHASI in the university context, like launching startups that answer the needs that you identify?
Yeah, that's a great point. And that's where I could see us collaborating with one of the research chairs on campus, John Thomas, who is working through the Esposito Center of Innovation. And so kind of that startup, I could see that's where a bridging of various centers on campus could work together. And then yes, to the point of, the goal is not that CHASI becomes the important part of it. It is, how do we facilitate and support community organizations, startups, as you've mentioned, to be sustainable, to do the work that they envisioned and they needed us. Maybe it's about research, maybe it's evaluation in order to get access to more government funding, but they need a research arm or an evaluation arm. We've just, I think in the last 2 weeks, we've been the evaluation arm for 4 federal proposals for community agencies that just reached out and said, we don't have the capacity, could you help? So yeah, our goal is not to be the thing, it's to support our community in as many different ways as we possibly can.
Okay, have you partnered or thought about partnering with any incubators in the community, like industry incubators? And
yeah, we haven't done it, but it's a great idea. Yeah.
Do you collaborate with any other universities? This is a question from Mary.
Yeah, Mary, we do. A quick example might be the project I just mentioned. CHASI, myself through CHASI, is a co-investigator on the proposal with Dr. Jardine, and we're working with the University of Manitoba on that particular project. It's a great example as well as a hub. I think we have 4 hub staffers working on that particular project, so very definitely. We also have had a couple of proposals that are more global in nature. Some work in Sierra Leone from one of our nursing faculty has reached out about developing something in that regard as well. So yes, very definitely.
Good question here. With the projects that you're working on, how do you go about measuring the impact?
Yeah, so it's a great question, because in some cases, a quick example might be, we were asked to do a needs assessment to support an agency looking for additional resources to support their clientele, in this case, preteens with mental health challenges. So in that case, we're not going to be around for the impact necessarily. We're here to say, how can we, sort of document the needs so that you can get the resources you need. And maybe at some point they come back and say, we'd love you to do an evaluation to see what the impact of those resources have been. But what we do know is that we rely on our understanding of literature in various spaces to know it will make an impact. That's the one thing as well I just would stress. We're really strong believers, before we start a project or need to take money from anybody to do a project, let's make sure that we need to do it. In many cases, we know what we need to do. We just haven't done it. Or in many cases, we know what we should do and we do the opposite. So yeah, we won't always know impact, but we absolutely could do impact evaluations as an example in some cases.
Okay, I've got a question here from Daniel. How does one bring something forward to the hub /CHASI?
just reach out. I think on our website, you have both my email, certainly martha.dow@ufv.ca, and you also have a general CHASI email as well. I'd love to hear from you. I mean, I think our biggest, we don't say no. That's not our job. Like we have to figure out a way always to say yes. And maybe that means leading someone to somewhere else so that they can get support, but that's help, right? Like we have to do that. And by the way, the other thing I would say is I really urge, I had even a faculty member say, hey, Martha, I got this money. It's not very much. One of the key aspects of CHASI is that while we might be involved in larger scale projects, we are trying to do things for small organizations and support them where there may be no money or there may be a very small amount of money. But that work needs to be done. And that's that nimble, timely piece that the divisions brought to us right at the beginning. We can't wait. We're not going to wait for a 9-month, cycle of tri-council sort of decision-making in some cases. Sometimes we need to be really responsive. So we want to do that. So Daniel, I'd love to hear from you.
Perfect. And Daniel and whoever else in the audience, we have posted the link and the email below in the chat if you do want to reach out. I've got a question here from Anoop. Are there opportunities for CHASI to collaborate with UFV India or other international organizations, or is this a more regional focus?
So we're very attentive to what we describe as our communities, but I think it's fair to say our communities feel very global in this world as well. So haven't directly done anything with UFV India, but we definitely are partnering with respect to proposals to funding agencies with respect to international projects. We have one of our staffers is working with a faculty member in kinesiology who has been doing research for a very long time and taking students abroad to do work in communities with respect to education and youth and looking at impact. And that professor has been wanting to do some follow-up research. So we're looking at funding sources to be able to support that project, among others.
Okay, great. Got a question from Aird here. They say community health and social innovation is hugely important to our civic government. How do you interact with and influence Abbey City Council?
Well, I don't think we influence City Council directly, but we would love, certainly our mayor has, he's been in the hub before, obviously all of the shutdown. And knows about us, and I think has spoken very positive terms around it. We haven't, we've got a number of projects currently out on proposal, just thinking about our timeline in Abbotsford. We've been approached by city councils outside of, those three, Abbotsford, Mission, Chilliwack that I mentioned to do work. But I think, so to give that example, we had a city council come to us and basically say, we need to do some work to figure out the needs of our older adults, what's going on right now, but most importantly, are we going to have to sustain as we move out? I know we're not talking about post-COVID, but what that looks like. So I do think CHASI can play a really key role for, again, that speedy turnaround of information when people are needing to make decisions much more quickly than perhaps a normal research cycle might allow.
Okay, great. Just wanted to let the audience know that this is a final opportunity to ask some questions. So if you do have one that you kind of on the edge of asking, now's your opportunity to ask it. But Martha, before we come to a close here on our time, what's projects or what is one of the projects you're having the most fun with? You mentioned fun as a important aspect to some of the work that you're doing. What's one that comes to mind?
Yeah. That's a great question, but it kind of sets me up with the staff, with the whole team, I think, a little bit if I pick one.
What is one that stands out first in your mind?
But actually, I can absolutely. I really do think we had a lot of fun as a group thinking about the tech side of social connectedness. I certainly when and Dr. McLean happened to be in the hub some time ago when we had the robots in the hub. And so I think that was a really great moment for students who are much more immersed in technology than I, as all of you could see from my high-tech presentation slide. But for them to see the connection between technology, what they were learning in terms of ideas around social connectedness from a lot of different disciplines, how they were feeling. And so that's one where we put a proposal out, we weren't successful in funding, and the team immediately said, well, this is too good. How do we reshape it? And we've put it out again. So I think that one was really exciting because again, it brought sort of this older adult piece, youth piece, technology side of the house that we all had a lot of fun with. So, and it's some really good work. So I'm hoping we'll find a pot of money that will support it.
That's great. So we're getting a couple questions left here. So it's partially a question, partly a compliment. How can you target our provincial government with your wonderful work?
Well, thank you. And I don't say this for any other reason. I have been so privileged to work with the students and the staff here. And I think what we're finding is that the energy is what will make a difference when whether it's targeting or whether it's trying to influence or whether it's trying to support. The possibility. I think we spend a lot of time these days thinking about why we can't do something, why we can't figure something out. And I think the more we're sort of thinking about possibility, the better. We're certainly looking at issues that have provincial ramifications for sure. It's hard not to look around right now and not be thinking obviously about horrendous assault that happened in Mission. It's hard not to be thinking about issues of human rights. It's our education system, what a systemic response looks like to an event such as that. So we want to provide as much as we can, be part of the university's leadership in these conversations. And I think those have provincial sort of obviously avenues to have those conversations. So we'd like to do that to a greater extent. So yeah, we've certainly had conversations and we continue to, and we look forward. And we also want to bring a critical eye. We need to feel comfortable challenging the status quo because there's a lot of problems with a lot of our systemic responses to issues around equity and access.
Okay, we have a final question here, and I think it has to do with, are there any projects right now specific to the response to COVID?
Yeah, absolutely. So again, can't say enough about Dr. Jardine's work with respect to looking at the mobilization of knowledge among students in terms of understanding COVID information. So the team has done surveys. They're now working on focus groups, talking about information in decision-making around travel and COVID. So that certainly is one that we'll be looking for. And I think they're very close to having a prelim report coming out. And that was also a partnership with the University of Manitoba. So that's a great one to look to as well. And then the other ones I mentioned have to do a lot with service delivery, right? So access issues with respect to COVID, a lot of interest around older adults for obvious reasons.
Perfect. Thank you. Thank you, Martha, again for joining us. That's been really, really interesting hearing about CHASI and some of the work that you're doing, and more importantly, the fun that you're having with the team there and the important work that you're doing for the communities that you touch. Yeah, thank you again for joining us here at Science Talks. And again, if you have any questions to do with CHASI or any projects, the email for the program is listed in the chat, and also recommend to visit the UFV website. There's a link to the CHASI program, the Health and Social Innovation Program at UFV. So thank you, Martha, and it's been a pleasure.